Pediatrics, children, infants makes no odds. Everybody gets the exact same. 100 to 120 compressions regardless of who it is. Okay? Now, a couple of things to look out for when you're putting a defib onto somebody. They say, as you see it initially, expose the chest. Alright? I would deem it appropriate to expose somebody down to their t-shirt to get a good hand placement for CPR. Especially if it was outside. Because dignity and hypothermia is also another problem, let's be honest. Down to the t-shirt. When the defib comes, or if the defib even comes, okay, in those packs will be a trauma shears. Take the shears out, through the centre of the t-shirt, cut the whole way up, including the bra, and expose the entire chest. Okay? Before you put the pads on, first thing they said there was pacemakers. Okay? Pacemaker is a hard raised area of the skin, scar tissue over it, size of a matchbox, and it's hard to touch, it's not soft, squishy. They haven't put pacemakers on this side the last 15 years, they're all over here, because that's where pads go now. But if you do come across it, literally very simple, move the pad slightly down. Don't go up over the collarbone and shoulder, because it's electricity to remember, and that's resistance. So move it a little bit south, okay? The next thing to look for is a hairy chest. In that pack there's a razor. Shave the area where the pads are going to go. Now, I'm not talking about the fella that has 1 or 2 hairs. I'm talking about fellas that take off the jumper, they're still wearing a jumper. That kind of fella, alright? Give that a shave. If there's no razor in the pack, alright? It's kind of funny, women in the class are laughing, they know exactly what I'm talking about. We've obviously met people like that in our life. But yeah, the razor, shave the area where the pad is going. Alright, if you want to be special, you can write your name in later on. But at the moment, shave the area where the pad is going. If there's no razor, take out the first set of pads, absolutely bake them on and rip them off, and you'll wax all that hair off. Yet again, you're dead, so don't worry about it, alright? You're not going to be hurt about this. Get the second set and put them on, because we need good skin-to-skin contact in order for that to work properly. Okay? So hairy chest is one. The next thing you look for then is if they have a necklace. If there's a necklace on, we don't just go yanking it off. Move it to the side. As long as it's not one of the pad, it's completely fine. Okay? If they have nipple piercings, try and take them out. If not, leave them in. Don't fumble around. Okay? Try and take them out as best as you can. Alright? One of our instructors was messing with a group there last week. Told that we carried pliers on the ambulance to pull them in. Some girl was absolutely mortified. She was going home to take out her nipple piercing. Anyway, yeah, if you can't get them out, just leave them as they are. Okay? The next thing that we'll talk about is a thing called medication patches. So you know what a medication patch is? Morphine, good. What else? Nicotine, Nicorette, GTN. There's loads of different types of medication patches, yeah? They're basically sticky patches people put on their skin, guys, that have drugs inside them that get absorbed into the skin rather than taking it through their mouth, yeah? They have to be removed if they're found anywhere in the torso region. Because you're not going to see them anywhere else, because you shouldn't really look anywhere else in that circumstance. If they're found in the torso region, medication patches, there is a foil, aluminium foil layer in all their patches. And metal and electricity, obviously, you know, we want to decrease as much risk as we can. Alright? So, if you come across a medication patch in the torso region, it needs to be removed. However, how does the medication get from the patch into the body? Absorbs through what? Through the skin. So what should be on my hands then before I remove that? Gloves. Why is that? So it doesn't absorb into me. Yeah? It happened to one of our guys, learned that lesson the hard way. Did you ever hear that story about Joe Brady? No. No? One of our guys, when he was telling us there about a guy, probably not Joe, Joe was actually the guy who was there with him. He was saying that if you had a guy with him on the ambulance one of the days, you remove the GTN patch off the body without gloves. And GTN is a drug that can lower your blood pressure. So the guy ripped it off the chest and was doing a few bits on the ground, but as soon as he stood up, his blood pressure dropped and so did he. So the lads were obviously dealing with cardiac arrest, but also trying to deal with a friend who would collapse, so getting in the recovery position and deal with the patient. Imagine what the family thought was going on. Mental. There you go. These things happen, guys. So, you know, slip of the brain sometimes. My advice to you is, as I said to my crew, you need 2 things before you even go into a room, and that's PPE and consent. So it shouldn't even be an issue that I have to say that to you, but I need to reiterate that so you remain safe, obviously, and don't risk the absorption going into you. So removing medication patches, make sure you have gloved hands, okay? Pools of water fell in the chest as you've seen, clean them off. Make sure they're not lying in the pool of water and we're not in that pool as well. Okay? And drag them over and obviously do a CPR there and there. Okay? And the last one is.
Would you take the patch off if it's on the stomach or the waist as well, or just the chest?
Just the torso area here, yeah. Because remember the charge is going from here to here, so if it's down around here somewhere, it's fine. Okay? And then obviously bras, we know why bras are getting removed. Some bras have underwiring in it. Rather than trying to figure out which goes and which doesn't, that's why bras are just removed straight away anyway, okay? They'll hinder the pad placement as well, so they're just gone. And then, yes?
So what about like here next day, chassis removal now?
Oh jeez, their head looks low.
So what I usually have to take?
No, it's fine. No, it's fine. No. I forgot I've never been asked before. No, you don't. Well?
It's a localized shock, so it doesn't get set.
Yeah, absolutely. It literally travels from here to here. It doesn't go anywhere else in the body. So it's the torso region that we're looking at. Okay? Okay, actually, fair play, man. I'm used to thinking because like that again, very common in the care home. Wouldn't it be going to here and no, that's not done. The last question I'll ask you is, wait, if you had the pads on a patient and the machine is telling you shock advised, but your patient is heavily pregnant, what would you do? Jeez, you didn't think about that, did you? Straight in, cold, I like it. Let's give her a job.
But the person's pregnant, like, so it affects the baby as well. No,
Say again?
not to affect the baby as well.
Don't know, you tell me. What do the rest of you think?
Would it shock the baby as well?
It would shock the baby as well, yeah.
Are we made of fire?
Would you not put it on the baby?
Could be the baby's heartbeat, yeah.
Would you put it to the sides and not actually on their locker or something?
So, the reason why I said heavily pregnant is that some women carry obviously pregnancy really well, and sometimes it can be very difficult to tell. Typically in the heavy or late stages of pregnancy, it's a little bit easier to pick up on this stuff. If you knew your patient was obviously pregnant, you could, if you wanted to, move the pads from front to back, rather than down here, okay? Also, if somebody is heavily obese, and one pad is up here, and one pad is down here, that's a lot of tissue that needs to travel through. I'd move those front and back. Children, they're front and back as well. But what would you do about the pregnant lady? Would you shock or not?
Well, if you're a pregnant woman's heart stops the babies as well.
There's something going anyway.
If Mammy dies, you'll be guaranteed the baby's going to die, yeah? So what would you do? So the good news is, right, them machines, which to be fair, unless you obviously go into obviously either paramedicine or nursing and stuff like that, you'll do whatever the machine tells you to do. If the machine says shock, you shock. If it's saying that it means that Mammy and baby are both here, or baby's here and Mammy's here, one or the other. Because when it's going on, it's trying to detect the strongest heart rhythm. If Mammy is here and baby is here, it'll say no shock advised, but baby will eventually go here. Because remember, if Mammy's not breathing, there's no more oxygen in the body, so baby will go there. We did it 2 years ago. I did it in the UK. We had a lady that was pregnant in Nottingham. We shocked her, she was pregnant, and to be fair, Mammy and baby both survived. So there you go. Okay? But yeah, you do what the machine tells you to do, you don't hesitate. Okay? But remember as well, they're a very dangerous machine if used inappropriately. So, couple of tips, safety tips, and what I'll be looking for later on. First of all, when the machine is analysing, okay, the pads are on, it's analysing, where do you think your hands should be? Away from the body. Because if my hand is on it, what's it going to analyse? It's going to analyse me first. No, it'll analyse me first. And if it picks this up for me and there, it's going to delay. So my hand should be off. But yeah, more importantly, when it comes time to shock, you should definitely 100% make sure you're not touching them and nobody else is touching them for that matter before you hit that shock button. It happened to a friend of mine last year where he was on the chest basically, and he was a shock went into the body, but someone was supposed to be trained. She had a bit of a brain fart at the time. She hit the shock button and heard the thud behind her, and my mate was on the floor. Okay, now because he wasn't ill, his heart restarted, but it didn't restart correctly. He now has a different kind of arrhythmia, heart rhythm, because of that. And she's obviously gone out of the job, which was dangerous. They're very, very dangerous machines if used inappropriately. Okay, so it is on you to make sure that safety is used as well. Because remember, number one, safety. Okay, right. That's what cardiac arrest is. Okay, what's a heart attack? Does anyone know? Yeah, you're not wrong. Speak up. Let them let everybody hear you. It's all a big sharing circle now. It can be caused by a blood clot in the heart too. But yeah, typically it's a clot or a blockage. Okay? So cardiac arrest is an electrical problem, whereas a heart attack is a problem with the body. Right, so we know, right, that the heart pumps blood around the body with oxygenated blood to keep the body alive. But is the heart not its own organ? Is that not an organ as well? So does that not need its own blood supply? Obviously, to keep itself alive. Where do you think that comes from? Yeah, it needs its own blood supply, but from where? Has anyone ever heard of your aorta? Yeah? The main artery that leaves the heart out of the body. I'd like to hope you have, because you all have them. Congratulations. From the aorta, what happens is, as it leaves the heart, okay, it'll take a feed off itself and bring it back into the heart. Okay? That's what it does to feed itself. It takes the strongest blood possible. Okay? Now, when it brings it back to the heart, it then branches off into loads and loads of little arteries that surround the heart. Okay? So it technically encapsulates the whole heart with these little arteries. They're called coronary arteries. Okay? In a heart attack, it is a blockage, more predominantly a clot in one of them coronary arteries. Okay? That's what a heart attack is. Now, depending on the size of the clot and where it is in the heart, will depend on that heart attack going on for a couple of hours, couple of days, or instant death. Okay? Heart attack, if left untreated, obviously is going to stop blood flow going to a certain part of the heart, and the heart's going to stop. Cardiac arrest.
When you have a heart attack, you not notice they might eventually come on.
Typically people do. They know what's coming on. I'll get to the symptoms in a minute. But that's what's going on. It's a clot in the heart.